Today we're going to talk about the two main reasons why I would send a patient to see a spine surgeon. My name is Dr. Musson. I'm an interventional pain physician practicing here in Corvallis, Oregon. So in my practice, the majority of the patients I see are dealing with spine problems, and the total amount of patients that I send to see a spine surgeon out of those patients is actually quite small. Ideally, my goal is to keep patients away from seeing the spine surgeon. I would like patients to improve with the least invasive option possible. So the number one reason why I would send someone to see a spine surgeon is for nerve damage. This is most commonly due to a nerve root being pinched in the back called radiculopathy. If this is in the lower spine, this is often referred to as sciatica. This is often due to a disc herniation compressing on the nerve or from the degenerative process narrowing the opening where the nerve comes out. So nerve pain from a nerve being pinched isn't necessarily something I would send a patient to see a surgeon for. If there was actual damage, that's when I'd send the patient. So how do you tell if a patient is having nerve damage from being pinched? Well, usually the symptoms are a little bit more severe. So more than just some pain, numbness, tingling, usually it's a more constant numbness and even weakness. If we want to get a better view of how the nerve looks, we'll do electrodiagnostic testing. That's where we do nerve conduction studies and electromyography, looking at the nerve, and with that test we can actually see if there's any nerve damage. Specifically, we could see if there's nerve fiber damage, also called axonal injury. So that would show up on electromyography. So that's a little bit more of a severe nerve injury. If you're just damaging the coating or the myelin sheath, that's not as severe. That can potentially heal if the compression isn't too bad. The EMG can also show how recent the damage was, if it was within the last 3 months or last 6 months, or if this was an old nerve injury over 6 months ago. Another type of nerve damage that can happen in the lower spine when someone has something called severe spinal canal stenosis and the central canal is severely narrowed and compromised. This will start to compress or pinch the nerve roots as they pass down the spinal canal. Some of the symptoms a patient would have with this is something called neurogenic claudication. So as they go and walk, their legs develop weakness and numbness as the weight of the body puts a little additional pressure on those nerves with standing and walking. Often we can see bowel and bladder changes as well as some sensory changes in the pelvic area. The potential complication of this narrowing and compression is cauda equina syndrome, which could result in permanent nerve damage to these nerve roots as they pass out through the lumbar spine. Another type of nerve damage that can occur in the spine is when you actually have spinal cord compression. So a little bit different than the nerve roots coming off the spinal cord being compressed, but the actual spinal cord itself. This occurs either at this cervical spine level or throughout the thoracic spine as the spinal cord itself finishes or ends at around L1 or L2. So you could have a disc herniation or degenerative changes or an instability in the spine that could lead to compression on the spinal cord. This is a serious issue that we need to take seriously, as this can lead to permanent paralysis to the parts of the body below the affected area. Some of the symptoms patients would have with a spinal cord compression is you start seeing things like muscle spasticity. We also see increased reflexes on exam. On MRI, we can often see some changes to the spinal cord, indicating some swelling or edema within the cord itself. So essentially, anytime I see a patient with obvious nerve damage, now whether through EMG testing or significant enough where it's obvious on exam, I'll be sending them to see the spine surgeon. Doesn't necessarily mean they're going to have surgery, but it gives the surgeon a chance to evaluate them, and based on multiple factors, they can make that call if surgery is ideal for that patient. Now, for my second reason for sending someone to see a spine surgeon is if they have severe pain and if everything that I try or that I provide for that patient doesn't alleviate their pain significantly and they're just suffering. If I think there may be some surgical option, I'll send them to see the spine surgeon. Again, it's ultimately the spine surgeon's call if there's anything that they can actually offer to provide relief for that patient. We had one case with a patient like this where we tried different interventional treatments. He had thoracic spine pain from a disc herniation. It was relatively small but very painful. And so we tried a couple different interventional options and he just wasn't making the improvement we wanted to see, and his pain level was quite high and really debilitated, keeping him from working, keeping him from what he wanted to do. So we sent him to see a spine surgeon, and the surgeon did say, hey, yeah, there's some options we can try. The patient ended up having surgery, a very small procedure, Did quite well. Patient's not 100% better, but I was able to have a decent relief. So hopefully this information was of some benefit. If there are any topics that you want me to cover, feel free to comment below. Until next time.